News at 7.
Over 14 million people in the U.S. say they have an issue with that the upper arm fat. I'm one of them. I admit it. The FDA has now approved CoolSculpting to freeze the fat in your arm. Dr. Chaffoo is here to explain. I love it because this has always been for the tummy.
All the abdomen, the flanks were the initial treatment areas, right?
Right.
And they showed remarkable results with that. So they needed to do clinical trials, and then they've actually now recently approved it for treatment for the arms, the upper arms.
So why wasn't the arms originally a part of this?
Well, just because they needed clinical studies, long-term studies, and larger areas like the abdomen and flanks are areas where they'd have larger numbers of treatments, larger numbers of patients to see the results, see if it, well, number one, if it was effective, and number two, if it was safe. And then of course they had to do treatment studies, clinical trials on the arm areas.
Okay, let's talk a little bit. We have some before. I'm a very before and after kind of girl.
Me too.
Okay,
right.
are
I'm
you
a plastic surgeon? Same thing.
So
it's all about what we
look.
look. Exactly.
Okay, so this is wow.
Yeah,
Dr.
it's remarkable.
Chaffoo.
So what we're seeing here, Shally, is we're seeing at least a 25, sometimes a 30% improvement with a single treatment session. And we sometimes will occasionally see a little skin tightening, as you can see in this patient. Now, the great thing about CoolSculpting, Shally, is it's very safe. There aren't any needles, there's no injections, there's no anesthesia, and there's zero recovery. Have a treatment done, 30 minutes, and that's it.
Okay, so we have Judy. Miss Judy is here.
Hello.
She has the CoolSculpting on your arm. So explain to somebody how this works.
So the way that this works, Shally, is we put a gel pad directly over the skin to protect that, and then the applicator is applied, and there's a gentle suction going on at that time.
Yes.
And then within the applicator, there are cooling pads that actually freeze the fat.
Okay.
The fat cells are killed by this freezing maneuver called apoptosis, a medical term.
Okay.
And then the fat cells gradually dissolve and are eliminated by the body. Anywhere from 6 to 12 weeks, you'll see the final outcome. And we're seeing results of 25 to 30% permanent fat reduction per treatment session. So we do have patients that will come back for a second or a third treatment. And the exciting thing, Shally, is that the results can get very similar to liposuction after several treatment sessions.
So when you, because that was the other thing, is most people have done like the liposuction thing, but you're saying that the results can get pretty close and you don't have to do that big surgery.
Yeah, depending on the, of course, the area and the individual patient, certainly it can be.
Judy, it says CoolSculpting, so is it cold?
It is.
Like really, really cold?
At first it's very cold. It's like a little pinch and then you don't really feel anything.
And then you've done this as well? Okay, and you're happy with the results?
Yeah, very happy.
And you see the results?
Absolutely.
Okay, how much does it cost? And where do we come to do this?
So it depends on the size of the applicator. So the smaller applicator is about $750 per treatment area. We have in the practice something called dual sculpting.
Yes.
So we have two machines. You can treat two areas at the same time.
Okay.
And it's about a 35-minute treatment per area. Larger applicators for like the abdomen area, it's about $1,500 per applicator.
Okay, and then you go back to work.
Go back to work.
I love it.
Go back to your activities.
Dr. Chaffoo, thank you for being here. It looks fun.
It is. I had it done too.
Raul, do you want to freeze anything off?
I'm good.
Come on.
No.
Where are you? You're over there?
Yeah.
I can freeze something.